Hello everyone, thank you for joining us today. I am Dr. Anka Chelebi, and Park Avenue Medical Spa has been part of the Armand community for almost 20 years. Today I would like to discuss some of my favorite treatments concerning acne and scarring. Please stay until the end of the presentation for a Q&A session. You can ask me questions using the questions tab. Acne is a chronic inflammatory condition, and it is characterized by comedones, white and blackheads, papules, pustules, nodules, and cysts. This can appear on your face, on your neck, chest, back, where there are more sebaceous glands. It is a common skin problem in adolescents, but also a lot of adults can experience it. It affects about 40 to 50 million people in the United States. There are several factors associated with this condition, and these are increased sebum production, increased keratinocyte proliferation, abnormal desquamation, and colonization by P. acne resulting in infection. Acne grading is based on the number, the type, and the extent of the acne lesions. Depending on the severity of this condition, we prescribe treatments that will target the particular causative mechanisms producing this condition. Routine endocrinologic testing is truly not necessary. Indicators of hyperandrogenism often can include menstrual dysfunction, hirsutism, which means excessive hair growth, or polycystic ovarian syndrome in adult women. The follicle wall may bulge and produce a whitehead, or the plaque may be open to the surface and darken, causing a blackhead. A blackhead may look like dirt stuck in pores, but actually the pore is congested with bacteria and oil, which turns brown when it's exposed to the air. Pimples are raised red spots with a white center, and that develops when blocked hair follicles become inflamed and infected with bacteria. Blockage and inflammation deep inside hair follicles produce cysts-like lumps that are right beneath the surface of your skin. Some of the complications of acne are the scars, which can be pitted or thick scars, keloids, and they can remain long-term even after acne has healed. Other skin changes after acne cleared can be hyperpigmentation or hypopigmentation. These type of complications are more likely in people with darker skin color than people with lighter skin colors. Other factors that can trigger or worsen acne are some medications. For example, drugs like corticosteroids or testosterone or even lithium. Some studies indicated that consuming certain foods, especially the foods that are high in sugars, carbohydrates, they can worsen acne. However, further studies are really necessary to examine whether people with acne would benefit from specific dietary restrictions. Stress doesn't truly cause acne, but if you have acne already, stress can worsen it. In all cases, here at Park Avenue Medical Spa, we recommend a specific deep cleansing acne facial. The pores are well cleaned to eliminate sebum and prevent infection. Exfoliation definitely helps to reduce hyperkeratosis, and that is part of your treatment. Other modalities that we use at the time of your appointment would be the blue light, because that can destroy the bacteria. The wavelength of blue light has an antimicrobial effect, and it makes it effective at killing several types of bacteria that can collect in your pores and oil glands and cause those breakouts. Blue light is safe, it is free from UV rays, and there is absolutely no pain or discomfort. The blue light therapy can be done alone, or as I mentioned, it can be part of your facial treatment. Other treatments that help with acne are certain peels, like the V peel. This very advanced acne solution works synergistically to combat active acne symptoms while repairing the darkening of the skin. The peel reduces the P. acne bacteria, the comedones, and sebum production, and unclogs congested pores. It also helps to fade some of the textural scarring and the PIH, which means post-inflammatory hyperpigmentation, and that is caused by acne breakouts as well. It is safe for all skin types, and it does require some downtime, but it is minimal. You should definitely see an improvement in your skin in about a week or so. Scarring is another major concern of those who suffer from acne, and depending on the severity of scarring, we have a few options. If the scars are mild, then microneedling is a good option. This treatment is done using a handheld device, and this is designed to increase the effectiveness of skincare product penetration and also promote new skin cell growth. Fine needles are used to create microchannels on the surface of the skin, and that enables penetration of ingredients such as vitamin A, peptides, antioxidants. They penetrate skin much more effectively. This process also stimulates the production of collagen and elastin in the treatment area. For deeper scars, radiofrequency microneedling is a treatment we offer, and that also can be safe for all skin types. It uses revolutionary nanofractional radiofrequency and a smart scan technology. It delivers good results through a selective dermal healing process. Tiny micron pins deliver the energy to the dermis, generating heat and encouraging production of collagen. This will help your skin look smoother and much clearer. For deeper scars, we like to recommend the Photona ablative laser. This can be used to treat both active acne but also acne scarring. The powerful anti-ag laser penetrates the skin to address overactive oil glands, and that can reduce the severity of inflammation and sebum production. The erbium ag laser can be used to resurface the skin, encourage collagen production, and that will reduce the depth of your acne scars. Ultimately, in combination with our in-office treatments, we do recommend a home care regimen, which generally contains a good cleanser, antiseptic, anti-inflammatory, and exfoliant. Other important products are retinoids, either by themselves or in combination with topical antibiotics, and hormone modulators, which will inhibit the effects of androgen on the cells in the sebaceous glands. Thank you all for watching. Please use the questions tab to ask any questions you may have. At the conclusion of the session, please respond yes to the text message so our team can help you schedule an appointment and inform you of all promotions that we have available with this presentation. Hello everyone, thank you for joining me today and watching my presentation, and I will now start answering some questions. The first question, does makeup make acne worse? So there are certain makeup products that can cause acne, which is why it is important when you choose your products, you make sure that they are non-comedogenic and they are not going to worsen your condition. And obviously, it is important that you clean well your makeup after each application and continue with your in-office treatments. Obviously, having cleanings of your pores periodically, it's going to reduce the chance of developing acne. Next question, does acne run in my family? Is bad skin genetic? So generally, there isn't really a gene that is acne or uh, can cause acne, but definitely there can be a familiar predisposition to developing acne. There can be certain conditions that run in family, like polycystic ovarian syndrome, and in that situation, you are much more prone to developing acne. Can I pop my pimples at home? I don't think that's a good idea for several reasons. One, if you're not really able to clean well, then you can develop an infection, and the infection can get pretty bad, and you can have severe complications. So I definitely would not recommend that you do that yourself. If you do have breakouts, that you uh, get that professionally extracted so that the pus is removed and it's well cleaned so that you don't run into problems. Also, scarring can happen as a result, so definitely not advisable to clean your skin at home. Is it worth to purchase a silk pillowcase? Does that make a difference? So as far as pillowcases, I think what's important is that you always have a clean pillowcase. You don't want to just because obviously the pillowcase, anything that you put close to your skin can produce infections. So it is important that whatever you use, it's going to be always clean and change it frequently. Does Accutane, next question, does Accutane really work? Yes, Accutane definitely works. It is important, however, prior to deciding to go on any treatment, that you have a consultation with a professional that can truly advise you what's going to be the right treatment for you. And there are situations where there are no other good treatments other than Accutane. However, right now there are a lot of excellent treatments for acne. So definitely before starting any treatment, it is important that you check with a professional that specializes in acne treatment. Does swimming every day make acne worse? I don't think swimming can be a reason for developing acne. I think it is important after you swim, especially in chlorinated water, that you do rinse it well off. But just swimming by itself should not really cause an increase in breakouts. Um, do the deep clean facials hurt? Oh, well, I think that obviously the pressure and the extraction. However, we have ways of doing it, and if the person that's doing the treatment is well versed and very well trained, it is truly not painful. If the extractions are painful, most probably they are not done by someone that is a very well trained in doing extractions. How often can you have the blue light facials? So generally, facials by themselves, we recommend every 3 to 4 weeks, depending on how fast you clog on the amount of oil and oil production. Obviously, people that have very oily skin, they're going to clog up a lot sooner than others. So in those situations, maybe you should come in for a pore cleaning once a month, every 3 to 4 weeks. However, blue light, oftentimes we even recommend once a week for a number of treatments in order to help with oiliness and reduction of breakouts. If you have acne and rosacea, what treatment would you suggest? So there's going to be a treatment that will focus on obviously cleaning your pores regularly, and also a treatment for rosacea that can involve lasers and certain medical treatments as well, ways to reduce inflammation. So I would recommend in those situations that, again, prior to embarking on any type of facials, you do have a consultation with a professional who is well versed in treatment of both acne and rosacea. Is acne an age thing? Will my son outgrow it? Do we need to aggressively treat it while in his teens? Um, So, how aggressive you are going to be truly depends on the severity of the acne. That is number one. So, how intensely you treat that during adolescence has no bearing on uh, later on in life. I think what you would want to do is obviously to prevent the complications of acne, and that is pretty much the scarring which can happen as a result of severe acne. What is an example of hormone modulator product? So spironolactone would be one that we often use as a hormone modulator. So I just want to remind everyone that you will be receiving a text, and answer yes in case you would like to schedule a consultation and find out what are the promotions that are available with this presentation. Thank you very much for joining me today. I hope this was an informative presentation, and I am looking forward to seeing you in our facility. Thank you very much. Have a good evening, everyone.